Hi students, I am Dr. M. Ashraf Majrooh, Professor of Community Medicine. I welcome you in the learning session of Policy and Planning for Health Education and Health Promotion. The highlights of this session are Health and Quality of Life, Charter and Agenda for Health Education and Health Promotion, Target Population and Health Issues, Steps for developing health education health promotion programs, Precede and Proceed model of health education and health promotion, health education and health promotion interventions. So let us discuss the highlights one by one. So first agenda of today's discussion is health and quality of life. The health is defined by WHO as physical, social and mental well-being, not merely absence of disease. So these three dimensions, they determine the quality of life, that is the physical well-being, social well-being and mental well-being. In physical well-being, the free from sickness, better health and positive health. So the enjoyment of fullest, highest potential for health is the quality of life, and free from sickness is the minimum requirement, and then is the better health and positive health. In social well-being, the quality of life, the person needs social harmony, social justice, basic need fulfillment, and decent living and education. In mental well-being, the mental dimension of the health, the person should have the realization of own ability and able to cope with the normal life stress and able to work productively. So these are the physical, social and mental dimensions of the health, and the quality of life is embedded in this WHO definition of health. Let us see how these dimensions are interpreted. One of the index which interpreting the quality of life is Human Development Index, and the Human Development Index consists of three areas. One is the life expectancy, healthy living, and other is the education, and economic side is the income. So these three indicators make this composite indicators that determines the quality of the life. So what are these indicators? The dimensions include long healthy living, having the knowledge, and having the decent living standards. So these are three dimensions, and they are measured through certain indicators. These indicators include the life expectancy at birth, and mean years of schooling and expected years of schooling. The difference between the mean years of schooling and the expected years of schooling will give the educational index. And third one is the gross national income per capita, and this is gross national income index. So these three indices, the life expectancy index, the education index, and the gross national income index, these three index, they are the measuring indicator for the Human Development Index. And this Human Development Index is the composite indicator of all these three indicators which reflects the quality of life. Now let us see the charter and agenda for health education and health promotion. The charter of health promotion as defined by WHO in Ottawa Charter. And the health promotion is the process of enabling people to increase control over and to improve their health. So, enabling people to control over their health is a defined agenda or the charter, WHO Charter for health promotion, and it further elaborates to reach the state of complete physical, mental and social well-being. An individual or group must be able to identify and realize the aspirations to satisfy the need and change or cope with the environment. And what environment and what basic needs are defined in the Ottawa Charter of WHO, that is the need for the person for quality of life, for health promotion, is the peace, shelter, education, food, income, a stable ecosystem, sustainable use of resources, social justice and equity. These are the defined parameters for the health promotion, and these parameters are health needs defined by WHO in Ottawa Charter of Health Promotion. So this is the Charter for Health Promotion. Now, what is the agenda for health promotion? As it has been accepted now, the health is a major resource for social, economic and personal development. And on the other hand, the political, economic, social, cultural, environmental, behavioral and biological factors can all favor the health or may harm to it. So, for this purpose, the stakeholders are defined in this agenda are the governments, the social and economic sectors, non-government organizations, local authorities, administrative authorities, and the media. These are the stakeholders, and the desired action from these stakeholders are the advocacy for health, enabling action to support, and mediation through coordinated action by stakeholders. So these stakeholders are responsible for advocacy, enabling and support and mediation for health promotion and health education, and this is the agenda for the 21st century as per Ottawa Charter of health promotion. Now the target population and health issues for health promotion. The target populations for the health promotions are divided into the general population, workplaces, institution and organization. In general population, the individuals and families at home, they may be the target for health promotion, and community living in geographical areas, cities, towns and villages, they are also included. And the population subgroups like mother, infant, children and geriatric population, these are the vulnerable subgroup of population to whom the health education and health promotions, they are targeted. Then at workplaces, this is very important that the occupational places, they should be comfortable and on the basis of ergonomic rules. And the workplaces include the heavy and small industries, pharmaceutical, healthcare setting, hotels and other business places. So all the personal protection and health education services must be provided at the workplaces because the workers, they are more vulnerable and they are dependent for the assistance on the organization where they are working, and the employers must be bound for their to provide the basic rights of the human health. Then institution and organization, these include school, colleges, universities, armed forces, and police. Professional organization like airlines and other so many organizations. The people working in those organizations, they are the target population for the health promotion. Now, what are the health issues? The health issues are divided into four categories: the health related underlying social factors, environmental factors, underlying factors, they are affecting the health, and then there are direct risk factors for health. They are in the category of direct risk factors, and then the clinical manifestation of the diseases. So these are four areas of the health issues which are targeted for health promotion and health education. The health related social issues include the population dynamics, poverty and income, social and health justice, health services, social norms and values, social instability or wars, and the natural calamities. So these are the social underlying factors that may affect the health, and they must be addressed through the health education and health promotion. The environmental issues are very important, and they include the housing, water and sanitation, air pollution and noise, global warming, radiations, ozone depletion, deforestation, and industrialization. So any damage to the environment of the planet may ultimately disturb the ecosystem for health. So these environmental issues, they are directly related to the human behaviors. Then direct risk factors, they are included that the nutritional status of the population and how they behave for nutrition, nutritional habits, the lifestyle and behaviors related to personal hygiene, smoking, addictions, then physical activity, personal hygiene, smoking, drug addiction, and living standards. These are the direct risk factors which directly affect the health. Then after that, there are clinically established diseases. These diseases, they are classified as communicable diseases. They may be endemic diseases like malaria, measles, mumps, tuberculosis, HIV/AIDS, hepatitis, sexually transmitted diseases, and the epidemics like COVID, SARS, and MERS. The non-communicable diseases, they are posing the health issue. They are cardiovascular diseases, cancers, diabetes, accidents, and lung diseases. These are now called the slow modern epidemics. So the health education and health promotion have to be, they will target all these issues related to health. So let us see the steps for developing and implementation of health education and health promotion programs. The steps include the social assessment of the quality of life. This is the first step. We will discuss in detail this step, and then epidemiological behavior and environmental assessment. the educational and organizational factor assessment, the administrative and policy assessment, and implementation of the programs and the process monitoring. So these are looking to be 5 steps, but they are 8 steps when they are translated in Precede and Proceed model of health education and health promotion programs. What is this Precede and Proceed model of behavioral change through health education and health promotion? This model consists of the 4 stages from right to left. The first stage is the assessment of the quality of life, and the second stage is the phase 2 is assessment of behavioral and environmental causal assessment, and this includes the genetic and behavioral and lifestyle and environmental assessment. They are the part of the human ecosystem. So this second phase of assessment will specify the areas where the health education and health promotion programs are targeted. Then the educational factors and organizational factors, they are further analyzed in the form of predisposing factors, reinforcing factor, and enabling factor to be targeted through the health education programs. And at the 4th step, the educational and informational training behavioral change to be targeted, and the stewardship for the health promotion and health education program, and the policy regulation must be assessed. And all these 4 assessments, they are essential. And then in phase 5, after the assessment and through the policy and regulation, the health education programs, they are implemented. And in phase 6 of this Proceed and Proceed model, the process evaluation is done, and then the outcome evaluation, impact evaluation is done, and lastly the outcome evaluation is done. So we will concentrate on these phases of these assessment and how these programs, they are translated into actions. So in first step, the social assessment, which I have already mentioned. In social assessment, the 3 areas are important, that is the community organization and community mobilization, and then social assessment. What is this community organization? In this, the peoples or groups, they are helped to identify for common problem, and there is mobilization of resources for the implementation of the program and to develop the implementation program. The community is mobilized to develop the health promotion and health education programs. Then in community mobilization, the community members define prevention needs and mobilization of resources, obtain support for community programs. No health education and health promotion program can be run without the support of the community, with the ownership of the community. Community mobilization will give the ownership to the community-based program planned for the health promotion and health education. Then social assessment to identify the objective and subjective informations, and help to understand the people's problem, aspiration, and then we will make a concept and map the concept, what are the goals and where we want to go. So this is the overall, in first step, these three areas of assessment are targeted, and this is generally based on the qualitative methods of assessment through the key informant interviews and the focus group discussions. So the strategy of this assessment is mainly the qualitative research. Then step 2, epidemiological assessment. This assessment will specify the problems and issues which are to be targeted through the health promotion and health education programs. The health problem and issues include identify health problem, issue or aspirations, set the priorities for issues, and translate the issues into measurable objectives. So in epidemiological assessment, the quantitative method will be used to assess the problems and to define the measurable objectives. The behavioral assessment include the personal lifestyle linked with the health risks and others' lifestyle linked with the health risks. So not only the personal life is affecting the health, but the behavior of the others is also affecting the health, and usually the others' behavior is addressed through the regulation, health regulations. And then environmental assessment cannot be ignored. The modifiable social and physical risk factor of the external to the individual that influence the health. They include all physical, biological, and social environment around the individual. They must be assessed and pinpoint through, and in this assessment, both quantitative and qualitative methods are used. In quantitative methods, the data collection is done, and in qualitative methods, the focus group discussion and in-depth interviews are done. Then step 3 is the educational and ecological analysis. This is very important, and this will analyze the behavioral factors into 3 categories. What are the predisposing factors, what are the enabling factors, and what are the reinforcing factors. This will actually pinpoint the intervention areas. So this third step is very important, and it will identify and pinpoint the interventional behavioral intervention which are addressed through health education. So in predisposing factor include the knowledge, attitude, beliefs and values, perceptions, confidence and capacity of the people which are targeted for health promotion programs. Then the enabling factor, this includes the skills, the resources, accessibility to facilities, availability of services, physical, mental capabilities, government policies, priorities for health. So these are the enabling factors. They must be addressed. Unless they are not addressed, the person is not able to adopt the desired behavior through the interventions. Then a reinforcing factor include the appreciation, encouragement, recognitions, tangible incentives and disincentives, and sense of achievement. So the encouragement and recognitions for the positive behavior, and discouragement and disincentives for the undesired behaviors, they will reinforce the desired actions. So these are the three areas of intervention which can be first evaluated, and then the intervention program for health education and health promotion must be designed. In fourth step is the analysis of the administrative and policy alignment for the interventions. These include macro level, mean organizational level, consider the organizational and environmental systems that can affect the desired outcome. Then at micro level, focus on the individual, peer, family and other who can influence the intended audience health behaviors more directly. So both at macro and micro level assessment is desired in policy and administrative level. And the focus of this policy assessment is the prioritization, prioritize the community preferred interventions, and mapping of intervention to predisposing, reinforcing, enabling factors mainly influenced by the community behavior. So these are the areas which to be evaluated at the policy and administrative level. And in Precede and Proceed model, it is mentioned that in Proceed and Precede model, they are mentioned as the stewardship for the health education programs. Then in step first 5, the implementation, this is the implementation step and monitoring step. And in this step, the individual and the collective factors, they are first benchmarked. And this is the baseline benchmark for the individual collective factors and the socio-economic environmental context. So in this benchmark, then specific interventions for change are designed in all three areas, as it has already been mentioned, in predisposing strategies, enabling strategies, and reinforcing strategies. In predisposing strategies, the school curricula in coordination with the health department, and the information strategies and the persuasion and stimulation. All these factors for behavioral change must be considered and implemented for change. Then enabling strategies include skill development, trainings, structural change in the organizations, access to technology, and urban planning. All these are enabling factors. Enabling mean they make easy to adopt the desired behavior. These are basically the circumstances that leads to the behavior conducive to health through these changes. Then reinforcing strategies, feedback indicators, tangible incentives and disincentives, social incentives and disincentives. These will encourage the desired behavior and may discourage the undesired behavior through disincentives and discouragements. Then what change we expect from these interventions? In predisposing factors, the knowledge and skill will be increased, awareness will be increased, and possible change in the attitude and the values. And while the enabling factors, they are addressed, then skills will be improved, increase in availability, affordability, options, and sense of self-efficacy is improved. These are the desired changes through these interventions, and reinforcing factors, uh, evaluation evaluations, the best action change, and social pressure change. So the people, they will evaluate that this is the best and they have to adopt, and the social pressure will appear for adopting the desired behavior. So through these areas, through improving the predisposing factors, through enhancing the enabling factors and reinforcing factors, the ultimate desired intermediate impacts is the positive change in health behavior and the positive change in the community environment. And ultimate goal is the behavior that may be conducive to health and that may be able to improve the life quality of life. So and this area is showing the end line benchmark where we want to go and from where we have started. So the step 5 is the hallmark of the implementation process. Now monitoring and evaluation is in the precede and proceed model. They are 6 to 8 steps, and the 3 steps, apart from 5 steps which I have already discussed, they include the process monitoring, mean monitoring the health education and health promotion program intervention, and they will determine the extent to which the program was implemented according to the protocol. Then impact evaluation will identify the intermediate achievements, assess the change in predisposing, reinforcing, and in enabling factors, as well as in behavioral change and environmental change. Then outcome determines the effect of the program on the health and quality of life. So this is how the programs, they are first designed through situational analysis, and then they are implemented, and then they are evaluated for the change. Now the health education and health promotion interventions, we will discuss some of the important interventions which are used in health education and health promotion programs. This first set includes the awareness, the advocacy, the motivation. These are very important interventions. And what is awareness? It is to inform and make aware about the behavior of interest to the people and the target communities. And this is just at the initiation. First, the people, they are sensitized, and for this purpose the electronic media, print media messages can be used, and at where feasible, the interpersonal communication in the target groups can also be used to create the awareness. Awareness is just sensitization of the population regarding the desired behavior, and it will lay down the foundation of informed choices. Then advocacy is convincing strategic level stakeholders for the recommendation and implementation of the policy in favor of public health. This is, I personally feel, this is for the strategic level and implementation level, and usually this is done through the interpersonal communication, like roundtables, the stakeholder meetings, and these are the best way. But sometimes the other media, print media and electronic media, they can also be used for advocacy. Then motivation is the channelization of the inner desires of the individuals for desired behavior, and dissemination of specific messages for reasoning to change the behavior and environment conducive to health. And motivation can be exercised through the electronic and print medias. Interpersonal communication is the most important way of motivation, and that is why many programs like family planning and other programs, they have set their outlets and they have engaged their own motivators for the purpose of for desired behavior. The electronic and print media can also be used for motivation. Then more interventions include the counseling, facilitation and reinforcement. The counseling is a very important way of health education and health promotion. And this is basically enable the individual to have the best choice, available best choice. And this is the give the professional help and advice to specific target groups to resolve the health problems. I have given the examples, the counseling for diabetic patients. That means the technical advice will be provided how the diabetic patient can monitor his own sugar level and how which diet they can, and dietary counseling is also their nutritional counseling is also through the counseling, and here the technical professional advice is given. And interpersonal communication is the best choice. Other media channel can also be used, but interpersonal communication is desired when face-to-face meeting the options are offered and the choices are offered. This is the counseling. Then facilitation is actually the technical support and creating enabling environment and to make the action or the process easier for adoption. So this is meeting both formal and informal communication. So this is both way, the technical support and creating enabling environment. This is the facilitation intervention. And there are multiple intervention at workplaces and in the institution where the environment can be the people, they are facilitated for the conducive behavior to health. Then reinforcement, it is very important. The incentives and encouragement for the desired actions, disincentives for undesired actions will reinforce the desired attitude and behavior. So this is very important to give feedbacks and encouragement remarks and appreciating the desired behavior and discouraging the undesired behavior. All types of media and interpersonal communication can be used for this sort of intervention. So lastly, the summary and conclusion of today's session, the health and quality of life is the outcome of direct and indirect behavior and the environmental factors. The behavioral change are targeted for predisposing, enabling and reinforcing factors, and motivation, counseling, facilitations are required for the behavioral change. So this is the take-home message in this session. Thank you for listening.